Hello, my name's Laura Pizzorno. I'm the author of Your Bones, and I'm here today to share some information with you that I hope will help you to have healthier bones. The topic of this video and the next several videos to follow is the latest research findings on the long-term effects of gastric bypass surgery and other forms of bariatric surgery, which simply means surgery to treat obesity, on the health of our bones. After seeing two very recently published papers in the February and March 2015 issues of the Journal of Clinical Endocrinology and Metabolism, both of them confirming that bariatric surgeries cause relentless bone loss, I've spent the past several weeks reading up numerous papers on this adverse effect of bariatric surgery because these surgeries are increasing astronomically. I also Googled bariatric surgery to check the websites of numerous hospitals offering these procedures, and also looked at the official website of the American Society for Metabolic and Bariatric Surgery and at the Weight Control Information Network, which is a part of our National Institutes of Health Information Services, whose mission is to, quote, provide the general public, health professionals, the media, and Congress with up-to-date science-based information on weight control, obesity, physical activity, and related nutritional issues, unquote. None of these resources, not a single one, even mentions that bariatric surgeries cause significant, unstopping bone loss. Only Wikipedia notes, quote, metabolic bone disease, osteopenia, and increased risk of fracture are common side effects of bariatric surgery. But even Wikipedia attributes these bone-destructive results simply to reduced calcium absorption, which the most recent studies investigating changes in numerous hormones that are induced by bariatric surgery now tell us is just the tip of a very large iceberg. For this reason, I felt compelled to try to summarize for you what the few who are doing the research and those medical professionals who are reading it know. And that is, we are talking about a lot of people who are affected here. 35% of Americans, 1 out of every 3 of us now, are considered obese. If you've had or are considering gastric bypass surgery, I very much hope that this information and the references provided from the peer-reviewed medical literature will help you and your doctor to work together to most effectively minimize the adverse effects of bariatric surgery on your bones and to protect your long-term health. The obesity epidemic is not just happening in the United States, it is occurring worldwide. The number of people affected continues to rise, and so does the use of bariatric surgery as a solution to this problem. Even teenagers and children as young as 5 years of age are now being treated with bariatric surgery. And the most commonly performed bariatric surgical procedures, the Roux-en-Y gastric bypass and the sleeve gastrectomy, are not reversible. So we are going to have to find ways to counter the bone-destroying effects of these procedures and help their recipients, most of whom are young adults in their 30s and 40s, to keep their bones. In this series of videos, I'll be talking about what researchers are now thinking are the possible reasons why people who have the Roux-en-Y gastric bypass or sleeve gastrectomy procedure, which are the two most popular forms of bariatric surgery, quickly begin to lose bone and keep on losing it with no signs of slowing down. For how long? As long as any of the studies conducted so far have run, and some have now collected data for 7 to 9 years. There are a number of reasons for this, and encouragingly, there's a great deal we can do to combat them, some of which are now beginning to appear in the medical literature. As with all my videos, these videos will be accompanied by a full listing of the PubMed references that I discuss, so you or your doctor can easily find and read these medical journal articles. So what is the latest research telling us? The most recently published studies, 2 papers were published, as I mentioned, in the Journal of Clinical Endocrinology and Metabolism, one in February 2015 and the other in the March 2015 issue, continue to confirm that gastric bypass surgeries, both the Roux-en-Y and the increasingly popular sleeve gastrectomy versions, cause significant ongoing bone loss. Unlike weight loss, which plateaus about 6 months after bariatric surgery, rapid bone loss does not. It continues, and how long and whether it can be stopped is anyone's guess. But bone loss was still occurring at the end of the 2 years during which these 2 studies were conducted. In other words, as long as they conducted data. And the same outcome has been seen in a number of other studies, including one published in 2004 in which subjects were followed for at least 3 years after gastric bypass surgery, another published in 2009 in which subjects were followed up to 5 years, and yet another published in 2014 in which subjects were followed an average of 7.7 years. Regardless of the length of time investigated, accelerated bone loss, unlike weight loss, did not subside. These findings are not all that surprising, given that both forms of bariatric surgery, the Roux-en-Y and the sleeve gastrectomy, greatly reduce not just the size of the stomach and thus the amount of food that we can consume, but the ability of our digestive tract to absorb nutrients. In our next video, we'll talk a bit about why these bariatric surgeries so greatly reduce our ability to absorb not just calcium, but all the nutrients that our bones require. I hope you'll tune in then. Thanks.